back, everyone. Did you know that 1 in 6 men will be diagnosed with prostate cancer? That is 4 million Americans. Joining us this morning from Gundersen Health System to tackle tough prostate cancer questions is urologist Dr. Scott Klein. Good morning, Dr. Klein. Thanks for getting up with us.
Good morning, Amy.
Have we seen the number of
Good to be here.
Have we seen the number of prostate cancers rise over recent years?
No, actually, it's more or less leveled off, but the important thing, I think, to remember is that prostate cancer is probably the second leading cause of cancer deaths in men over 50, and it's the leading cause of cancer in men over 50. So it's a very common cancer, and the trick is to pick it up early and then to define the type of prostate cancer it is, whether it's aggressive or not aggressive, high risk or low risk. And that'll determine the type of treatment that we use.
All right, so let's back up and talk about the symptoms. What should men be looking for?
The scary thing is that prostate cancer early on, when it's curable, has no symptoms. It's silent. It's only later on, when it's further advanced and most likely not curable, that it develops symptoms, that you develop symptoms from it. So we really need to be picking up this cancer early on when it's silent.
So if there are no symptoms, how do men go about being screened for this?
The most common test that we use is a blood test called a prostate-specific antigen, or a PSA. It's a simple blood test. Although it's somewhat controversial, as we all know at this point in time, it's still the best test that we have, and it gives us the best option of picking up an early prostate cancer.
And it's controversial because it's been known to give false positives.
That's correct. It has false positives. It also has false negatives.
It does.
But it still gives us the best opportunity to pick up an early prostate cancer.
All right.
And that's the main thing. We want to pick them up early. That's when they're curable.
And what is treatment like?
There are multiple treatments that are available for early prostate cancers. If they're low risk, we can merely keep an eye on them. That means testing and regular examinations. If it's more aggressive, then removal of the prostate and possible radiation, either with little radioactive seeds or external radiation, all have good results.
But again, the key is for men, this cancer to be diagnosed early. That's their best chance at a positive outcome later on.
That's absolutely correct. We need to pick this up early. The chance of cure is extremely high if we pick it up early. And the side effects is a topic that we're going to be covering coming up next week, Tuesday. The two main side effects that most men are concerned about are erectile dysfunction and bladder control issues. And we have a seminar at Gundersen starting at 6 o'clock next week, Tuesday, June 11th.
And where is that taking place at Gundersen?
That's going to be at the Rasmus Center inside the hospital.
All right.
So, and I would recommend that people give us a call. The seating is somewhat limited, and it usually fills up.
Okay. You brought this up. Is this a topic, either with prostate cancer itself or bladder control, that men are talking about?
Men don't talk about it very much because they're private issues, but it's something that can affect them significantly. Both bladder control and erectile dysfunction affect them socially. Mm-hmm. If they're bladder control issues, they're not likely to go out and be in public. If they have erectile dysfunction, their interaction with their partner, their mate, is limited. But they're treatable. That's the main thing. These side effects are treatable.
All right. Well, Dr. Klein, thanks so much for joining us this morning, and hopefully you'll have a good attendance on June 11th there. Thank you so much.
Thank you very much, Amy.
The 100